So, good day, Ma'am Kalinawan. My name is Bialo Elo Chavez. I am student nurse from Brokenshire, second year student nurse from Brokenshire. Today, I'm going to conduct a perineal care for women. So, perineal care it involves through cleansing of the client external genitalia, anal area, and surrounding skin. The purpose is to prevent or eliminate infection and odor and also promote healing and provide comfort. For the preparation, assessed for the presence of irritation, excoriation, inflammation, and swelling, especially between the scrotal folds. So, excessive discharge, odor, and pain or discomfort. So, assemble the equipments and supplies. So, here's our equipment that we need, and it's already assembled to save time and work effectively. So, now don't forget to perform hand washing to prevent the spread of microorganisms. Hindi na yan. So now, after preparing the necessary equipments, let's explain the procedure and treatment to the client and how she can participate, provide the client the opportunity to ask for her concern and establish a good rapport to the client so that she would feel uncomfortable during the assessment. So now, I will close the curtains and door to provide privacy. It can gain cooperation and minimum exposure, lessen embarrassment, and helps to provide warmth. Good morning, ma'am. My name is Bialardo Chavez. I am your student nurse for today. May I know your name, ma'am?
My name is Kia A. Santiago.
So, okay. Is that okay that I'm going to check your wristband, ma'am?
Okay.
Okay. So, ma'am, the procedure that I'm going to do today is I'm going to perform a perineal care to you. This is to remove the normal perineal secretion, odor, and to prevent some infections such as infection and contamination of your genitals. So I will be touching some parts of your body, especially to your genitals. So is that okay for you, ma'am?
Yes.
Yes, okay. So do you have any clarification and concern, ma'am?
No.
Okay. Ensure to screen the patient and lock the patient room to provide the patient privacy. So the patient is so now the patient is already covered with the blanket. So now I'm going to position the patient into dorsal recumbent with her knees flexed and put the patient on the bedpan. So this is to prevent the bed from becoming soiled. So ma'am, I'm going to position you into a dorsal recumbent and flex your knees.
Okay.
So do the glovings to prevent the infection. So I'm done glovings. Here's the bedpan already in the genital area. Then so now drape the patient, exposing only the area to be cleansed. So minimum exposure lessens the embarrassment and to provide warmth. So, okay ma'am, I'm going to expose the area that I'm going to clean.
Yes.
Now let's inspect the perineum and flush the perineal area with warm water. So note for any particular inflammation, swelling, excessive discharge, and blood clots. And discharge irritation, and of course presence of odor. So warm water is used to dissolve the blood clot. So now get the cotton balls soaked in the cleansing solution using a pick-up forces to maintain the sterility. So now I'm going to start, so ma'am, I'm going to start cleaning.
Yes.
So to prevent the introduction of microorganisms to already clean areas. So cleanse the external genitalia starting from midline of symphysis pubis down to the anus. So don't forget to never restrain stroke to prevent the contamination of the area, then discard. So for the second cotton balls, clean starting from the mons pubis in a figure of 7 by way of external labium towards the anus, then discard. Then do this on the opposite side by the next cotton ball with the same stroke. So now for the fourth cotton balls, cleans starting from mons pubis in the and figure of 7 by way of external labium towards the anus, then discard. Then do this on the opposite side with the same stroke but another cotton balls. So with the another cotton balls, groin and surrounding area starting from the groin going to the thigh. So do this on the opposite side with the same stroke but another cotton ball. So we are done, ma'am. I'm going to flush thoroughly with the warm water. So now using 7 dry cotton balls, dry the perineum with the same stroke as above. Moisture supports the growth of many microorganisms. So now So now we're done cleaning the perineal area, the genital area. Then now let's remove the bedpan gently. If necessary, take 2 cotton balls and clean one side of buttocks, then clean the other side of the buttocks and dry the both buttocks to provide the comfort. Ma'am, I will remove the bedpan. Spray antiseptic if needed. This is to promote healing. So next, we're going to put the perineal pad with a up, down, and motion as needed to prevent the contamination of vagina and urethral from the anal area. So now we are done. So ma'am, are you comfortable now?
Yes.
Okay, so thank you ma'am. Thank you so much ma'am for your cooperation.
Welcome.
So now do the aftercare to maintain the cleanliness and remove the gloves, and don't forget to do the hand washing to prevent the spread of microorganisms.
Isa rin ang hangin ko.
Then discard. Discard. Hindi na yan. So now let's record the treatment done to the patient and discharges observed. So for documentation purposes, the procedure was done and means of communication. So now we're done the documentation.